And so today I want to deal with how do you close the deal financially? Because you can get them all emotionally engaged to where they're saying yes and they're excited about treatment, but now you have to overcome this financial hurdle of how much does it cost? And that's a reality we all have to deal with. And I first want to discuss with what type of deal is the hardest deal to close? What case is the hardest one to get closed? I think the two easiest cases, first easiest one is probably the person who's in pain. Their face is swollen out to here. It's going to be an extraction, maybe a root canal, but they're in pain and you want to get them out of pain. That's an easy one to close, I believe, because it's, as Tony Robbins says, people make change to avoid pain or gain pleasure. Get them out of pain, big motivator. I think the second easiest case to close is the patient who walks in looking for a smile makeover, a whole cosmetic makeover where it's a $20,000, $30,000 case, and they come in expecting a $20,000 or $30,000 case because that's what they want. They want to look younger. Instead of getting a facelift, they think maybe the place to start with is dentistry. Now, I think the hardest case to close is that $2,000 to $5,000 price range where they didn't expect it at all, they're not prepared for it, and they're shocked when you tell them they need $2,000 or $3,000 or $4,000 of dentistry. I think that's by far the hardest case to get accepted. So the question is, what can we do about that? Because that's probably the vast majority of your dentistry. I doubt it's very often you have the $30,000 case wander into the practice and the $75, $100 extraction because their face is swollen is not necessarily the type of dentistry you want to do. So what do we do with that middle section that is the hardest to get acceptance with? And there's a whole lot of things that I think we should do there. First off, I think when we're seeing the patient, whoever's seeing the patient, whether it's in hygiene, whether it's an emergency and the assistant is seeing them, whatever the case is, I think we need to make sure that we're planting lots of seeds along the way. So then when the doctor comes in, it's an easy layup. And I love how Bridget, one of our coaches, terms it overspeak. So what she suggests in hygiene is the hygienist that they're having a conversation with the patient about what they need. Then when the doctor comes in, the hygienist repeats that conversation, a shorter version of course, but repeats it to the doctor to inform the doctor of what it is the patient needs. So now the patient's heard it twice. And then the doctor does the exam, looks in the mouth and goes, man, Bridget's awesome. This is amazing. She's absolutely dead on about what it is you need. She should have gone to dental school. So put that team member up on a pedestal and then, affirm it. Yep, you're right. This is exactly what you need. You're going to need this crown, 2 crowns, whatever the case is. And, it's no big deal. We'll get this taken care of for you. And then ask that one final question, of course, of when do you want to schedule? That's the one question I see that often gets missed is sadly, sometimes we're sitting there, the patient's really engaged, we talk to them about the clinical benefits, they have bought in entirely on that, but then we fall short on finishing that process up with closing the deal. So I suggest that the doctor always ask the one extra question of when do you want to schedule? Because that way you can finalize and formalize that bit of process. Now, obviously the patient's probably going to ask, how much is it, doctor? And in the vast majority of cases, I don't know that I want doctors discussing fees. Some doctors, I think, do a great job at it. So this would be a great time to customize with your coach about how you should do it in your office. But generally speaking, don't want the doctor discussing fees. I want you to stay focused on clinical. If the patient ever asks you, the easy answer is I'm not really sure, but please talk to Bridget, our financial coordinator. She will find a way to make it affordable for you. And give them that peace of mind that we will make it affordable for them. And we're going to make it affordable for them through eye care credit, whatever sort of financial arrangement we need to make, which I'll discuss here in a second. So hand off that baton, if you will, of power to the financial coordinator in the terms of we will find a way to make it affordable for you. And for the most part, doctors, avoid that conversation of fees.